A devastating tragedy has struck Cambodia, leaving the nation on high alert. A young man has succumbed to the deadly H5N1 bird flu, marking a grim reminder of the persistent threat this virus poses to human health. But here's where it gets even more alarming: this isn't an isolated incident. According to the Cambodian Ministry of Health, this year alone, the country has recorded 17 human cases of H5N1, with 6 fatalities, a stark statistic that demands our attention. In a statement released on Sunday, the ministry confirmed that a 22-year-old man from Kien Clean village in Phnom Penh's Kroi Chang Var district had tested positive for the H5N1 virus. The diagnosis was confirmed by the National Institute of Public Health on November 15, 2025. Health authorities are now racing against time to trace the source of the infection and identify anyone who may have come into contact with the victim to prevent a potential outbreak. But here's the controversial part: how did this happen, and could it have been prevented? To contain the spread, Tamiflu, oseltamivir, an antiviral medication, has been distributed to those who had direct contact with the victim. However, this raises questions about the accessibility and distribution of such treatments in rural or underserved areas. Are we doing enough to protect vulnerable populations? H5N1 influenza typically spreads among sick poultry but can occasionally jump to humans, causing severe symptoms like high fever, persistent cough, runny nose, and acute respiratory distress. And this is the part most people miss: the virus's ability to mutate and adapt makes it a constant threat, not just to individuals but to global health security. The Ministry of Health has issued a stern warning, urging the public to avoid consuming ill or dead poultry, a practice that, while seemingly obvious, is still a risk factor in many communities. As we grapple with this latest tragedy, it's crucial to ask: are we prepared for the next outbreak? What measures should governments and individuals take to mitigate the risk of H5N1? Share your thoughts in the comments. This is a conversation we can't afford to ignore.